Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's COVID-19 update, the 66th weekly update that we've done with data accurate through August 19th, 2021. Today, I'm going to address a question that's been quite popular this week, which is what should I know about waning immunity and will I require a booster shot? And I'll do a quick pandemic update as well. Well, there's been a lot in the news this week about waning immunity and whether there's going to be a need for a booster shot or not. It basically comes from four sources. The CDC published some data from New York that looked at COVID cases. Now, this is cases. The dotted line is cases in unvaccinated. The solid line is cases in vaccinated. And you can see for the last couple of months, there was a decreasing number of cases and then it resurged. Two things are important about this. One is a huge difference in the number of cases between vaccinated and unvaccinated. But what the article was really focusing on was this increase in cases in vaccinated, this idea that the immunity that people have seems to be waning. It's important to point out that most of the data in this study and the other three I'm going to mention relate to cases and not serious disease. Because if you look at hospitalizations, there clearly has been an increase in hospitalizations in unvaccinated, but not a great deal of change in vaccinated. The second piece of information has come from Israel. They've looked at what appears to be declining effectiveness of the vaccine in preventing infection and symptomatic disease, even though it remains highly effective at preventing serious disease and hospitalizations. Now, the reason folks are paying attention to Israel is really two things. One, it has a pretty high vaccination rate, and they were vaccinated relatively early. So the fact that we're seeing an increase in cases and an increase in deaths in Europe has drawn in Israel has drawn a lot of attention to it. And the assumption is now that this represents waning immunity, that what was a good immune response to the vaccine may be weakening over time in terms of cases, but not so much in terms of serious disease. The third report was one out of Massachusetts and Minnesota that looked again at infections, again, a huge difference between unvaccinated people in gray and the Pfizer and the Moderna vaccine. But again, what's important is this increase in number of cases for those that have been vaccinated, suggesting a waning immunity over time. Now, if you look at hospitalizations, you do see an increase. You see a huge difference again between unvaccinated, but not a great deal of change in the vaccinated. So again, what we seem to be seeing is a increased number of cases and mildly symptomatic disease, not a huge change in more serious disease. And the final report came out of the CDC, looking particularly at nursing home residents, and they concluded again that they're seeing a decrease from 75% pre-Delta to about 53% effectiveness for infection. So what are we seeing? It looks like the immunity to SARS-CoV-2, the virus that causes COVID-19, appears to wane over time. This appears to be true both for immunity from natural disease and from the vaccine, though it's not as clear for the natural disease. The vaccine still appears to be effective at preventing severe disease and hospitalizations. It remains extremely important to get everyone vaccinated. Even before we talk about boosters, we need to get everyone vaccinated. But probably what's going to happen is towards the end of the month, the Food and Drug Administration and the Advisory Committee on Immunization Practices will probably recommend a booster, probably starting with the elderly, those with immune compromised conditions, and then healthcare workers, and then perhaps everyone, really focusing on those who are 8 to 9 to 10 months out from their initial vaccinations. Again, a quote from Dr. Walensky, the head of the CDC, points out again that the vaccine remains highly effective against serious illness and hospitalizations. And another CDC report says that among 164 million fully vaccinated. There have been 7,100 hospitalizations, 1,500 deaths. That seems like a lot until you realize that 1,500, it represents 1/1,000th of 1% of the vaccinated folks. So yes, it appears that immunity is waning, probably will require a booster, though it's premature to say definitively. In terms of the pandemic overall, almost 4.5 million deaths, 1.6% increase in the past week. That's pretty much where it's been since about the middle of June, 1.6%. 68,000 deaths in the past week. That's 6.5 deaths every minute. So still a pandemic of very significant impact. And again, if you look at new cases, you see this undulating sawtooth pattern. It looks like the current uptick in cases seems to be leveling off, but again, it's still pretty high. In deaths, it appears also to be leveling off, as you can see, and again, not quite as high as it was either in the spring or in the winter time. In terms of the United States, we're seeing pretty much the same pattern, another spike in cases, higher than at any point during the winter, except during the winter. A significant increase in hospitalizations, and this worries us as well. In terms of deaths, we're seeing a slow increase, but still nowhere close to what we've seen before. So in the US, so far, 640,000 deaths, about a 1% week-to-week increase. And again, it's creeping back up, but it's not anything like the numbers we saw last year or over the winter time. So we'll keep our fingers crossed and hope that this starts to level off. In terms of the 1% increase, that is the highest that we've seen dating back to April. So hopefully that's going to be a short-term trend. But 6,000 deaths last week, 870 deaths a day. That's about one death every 2 minutes. So please don't let anyone tell you that this pandemic is over yet. Very important to point out that across the United States, we're seeing wide variations in the death rate. And the reason is probably this. This is across the bottom is death rate last week, high deaths over here, low deaths here, and then the percent of the population that's vaccinated. These are high vaccinated. The states with over 60% of the vaccinations have relatively few deaths. The states with under 40% have most of the deaths. And there's the state of Tennessee, and there's a trend line. And you can see this very strong relationship between vaccinations and deaths. And it looks like we may even be starting to see some states approaching what might be considered herd immunity. So really, it remains as important as it has ever been to encourage folks to be vaccinated. It's actually more important to get folks initially vaccinated than to get the rest of us get our booster shots. I'm going to get mine when they recommend it, but at this point, if I could do anything, I'd get as many people vaccinated as possible. In the state of Tennessee, we're seeing the same kind of pattern with the US, with definitely a spike in cases and a very significant increase in hospitalizations, and noticeably hospitalizations in the pediatric population as well. Deaths have not yet come up as high as they were back 6 months ago, but they're definitely creeping up. 13,000 deaths so far, 1.2% week-to-week increase, slightly worse here than in the rest of the United States. But again, our death rate isn't as high as it has been. We'll keep our fingers crossed and hope that this starts to level out. Worrisomely, if you look at Ballot Health's reports, they report 200 patients in the hospital with COVID. That is the highest it's been since any time from the winter spike. Hopefully it's going to start slowing down, but it hasn't yet. So what do we know about waning immunity? It looks like perhaps 8 months or so after your shot, your immune system may be less effective at protecting against infection, particularly with the Delta variant, though it appears that it is still effective against preventing significant disease and death. Will I require a booster? We don't know. Probably towards the end of the month, there'll be an official recommendation. I suspect that it will be. I suspect it will start with high-risk folks and then move on to folks who've been vaccinated for 9 or 10 months or longer. The pandemic is continuing to burn quite hot around the world, in our country and in our state. And in the United States, there appears to be a very strong correlation between vaccination rate and death rate, with higher vaccination rates having lower death rates. And those states with lower vaccination rates, unfortunately, seeing more deaths. A great deal more information about COVID-19 on the College of Public Health website. As always, please feel free to share this video with anyone who might be interested. If they'd like to get on our mailing list, just let us know. I'd like to thank Derry Young for editing, producing, and posting this video. And as always, I'm driven mostly by the questions that I get from the viewing audience. I enjoy getting your questions. I try to address those that I can in the time that we have. I look forward to hearing from you. Until next week, please be well and be safe.